Good morning, everyone.
Good morning.
Good morning. Thank you all for being here this morning so we can talk about maternal health. I want to thank President Preckwinkle for joining me here today, as well as the other commissioners who are joining us to hear Commissioner Degnan, Commissioner Daly, Commissioner Britton, Commissioner Lowry, and Commissioner Trevor. And we also have Dr. Lamar Hasbrook here from Cook County Department of Public Health. So last year, I sponsored a resolution to have a maternal health hearing due to the appalling maternal morbidity and mortality rates and unacceptable disparities, especially for Black women, that was only made worse by the pandemic. That was almost 1 year ago today, and we learned a lot at that hearing, but in order to keep this issue front and center, I knew we had to again sponsor a resolution to have a hearing to get an update on the progress that we've made over the last year and the steps we need to take and continually work on to improve maternal health outcomes for all women. This has been a decades-long issue, and we will not see more respectable outcomes unless we keep this at the forefront of what we do at the county, at the state, and federal levels. What is so tragic and that we keep hearing over and over again is that up to 91% of maternal deaths are considered to be preventable. It is my hope that with this hearing, this will allow us to see where we are in the process of finding solutions to improve these numbers in Cook County and across all of Illinois, such as the creation as the Cook County Health Doula Program, which I secured $1 million in the health system budget, working with the Cook County Health leadership and the support of the county board. According to a 2021 report from the American College of Obstetrics and Gynecologists, continuous one-to-one emotional support provided by support personnel, such as doulas, is associated with improved outcomes for women in labor. Doulas can provide individually tailored, culturally appropriate, and patient-centered care and advocacy. However, only about 6% of women who give birth receive a doula care. At Cook County, we are changing that dynamic by standing up a Cook County Health Doula Program, which I expect to hear about later today in the hearing. I would like to see a coordinated plan developed with the cooperation of Cook County Health, Cook County Department of Health, Illinois Department of Health, and our private partners and hospitals to reduce these numbers even more. I look forward to today's hearing to get an update on the data and to examine the maternal health crisis and see how we can improve outcomes for all women in Cook County in Illinois. So thank you all for being here. I'd like to turn it over to President Preckwinkle for remarks. After President Preckwinkle speaks, if you want to help us guide us so each commissioner could have a few words. Thank you.
Thank you, Commissioner Miller, and good morning, everybody. Good morning. I appreciate, Commissioner, you bringing us together today as we highlight an issue that demands our urgent attention, maternal health. I'm also pleased to be joined by Chairman John Daly, Vice Chairman Bill Lowry, Commissioner Bridget Degnan, Commissioner Maggie Trevor, and Commissioner Scott Britton and Bill Lowry. Did I get everybody? Okay, all right, good. Also, we're grateful that Dr. Lamar Hasbrook, who's Chief Operating Officer for Cook County Department of Public Health, has joined us as well. And we're also joined by Commissioner Anaya. Thank you very much, Commissioner Anaya. Your support underscores the collective commitment of Cook County government to address this critical issue. At Cook County, we stand united in our mission to improve maternal health and access to care. This commitment to care and equity is deeply embedded in the mission of Cook County Health, which for more than 180 years, almost 2 centuries, has provided high-quality care for expecting families, women, and children. As part of that commitment, Cook County Health has welcomed all who come through its doors, all. Our dedication to equity means that we're dedicated to solving problems affecting under-resourced communities. It also means providing equitable access to care for residents, regardless of race, ethnicity, religion, zip code, or ability to pay. As commissioners delve deeper into the discussions of maternal health at today's meeting, let's be reminded of the stakes involved. These are our mothers, our sisters, our aunts, our daughters, our family members. These disparities in maternal mortality and morbidity across Cook County and across the nation are unacceptable. It's imperative that we continue to harness our collective expertise and resources to forge pathways that will lead to better health outcomes for all mothers in all communities. Now, usually we do this by asking the chair and the vice chair to speak, that is the chair and the vice chair of finance to speak first. But since this is a women's issue, we're going to ask the women to speak first. We'll start with Commissioner Degnan, Commissioner Trevor, Commissioner Anaya, and then we'll come this way. Okay, let's start with Commissioner. Thank you.
Thank you, everybody. Well, first, thank you all for being here. My name is Bridget Degnan. I'm the Cook County Commissioner in the 12th District, which covers parts of Chicago's north and northwest side. And I want to thank our County Board President, Tony Preckwinkle, and Commissioner Donna Miller first for having this press conference and bringing this really important topic to light. As you may not know, the United States has a maternal mortality rate many times greater than that of other industrialized nations, and the COVID pandemic only served to worsen this crisis. In 2021, we saw a 40% increase in maternal deaths, representing the deadliest year for pregnant women and mothers since 1965. The pandemic contributed to a quarter of all maternal deaths in 2020 and 2021. And will continue to have negative effects on maternal health for years to come. What the pandemic has further shown us is that there's a heightened need for more comprehensive and accessible maternal health care, particularly for Black and African American women, who have rates of maternal mortality greater than double that of non-Hispanic white women. The maternal death rate for Black and African American potentially life-threatening conditions, often long-lasting health problems for mothers and children, and have had a disproportionate impact on Black and African American women and families in the United States. Statistically, in Illinois, Black and African American women fare no better in pregnancy outcomes than those nationwide. Women in Illinois who have no prenatal care had a severe maternal mortality rate 3 times that of women with access to prenatal care. Providing equitable access to prenatal care in Illinois would